Hi everybody, this is Renee. We are going to discuss influenza in this voiceover. Influenza is a highly contagious infection that is rapidly spread from one person to another. It's divided into three different types, A, B, and C. Each year the outbreaks are tracked, recorded, and then reported to the CDC. Influenza is caused by inhalation of small droplets from an infected person's sneeze or cough. Individuals with influenza are infectious for about 7 to 10 days. So the clinical manifestations of influenza or the flu are more severe than those of a common cold. The symptoms come on very quickly and can include fever, headache, severe nasal congestion, cough, muscle aches and pains, and general malaise or fatigue. Diagnostic tests for influenza include the rapid influenza tests, which include either nasopharyngeal swabs or nasal washouts to test for the virus, or sampling of respiratory secretions for a viral culture. The annual flu vaccine is strongly recommended, and it is the best way to prevent the spread of the flu each year. Treatments for influenza include antipyretics, analgesics, rest and fluid, antiviral medications such as Tamiflu, which needs to be started within 24 to 48 hours after the first signs and symptoms, and antibiotics, and these are only if there's a secondary bacterial infection occurring as well. Antibiotics will treat the secondary bacterial infection, but they're not going to treat the flu because the flu is viral, not bacterial.
The annual flu vaccine is strongly recommended in the best way to prevent influenza from spreading each year. Treatment for influenza includes antipyretics, analgesics, rest and fluids, antiviral medications like Tamiflu, which need to be started within 24 to 48 hours after the first sign of symptoms, and antibiotics only if a secondary bacterial infection is occurring.
So patients hospitalized for influenza will be on droplet and contact precautions. For nursing actions and interventions, we are going to provide humidified oxygen, antipyretics, which will help with their fever, analgesics, antiviral medications. We also want to keep the head of the bed elevated at least 30 degrees to help facilitate breathing. We will give them fluids, and if they can't tolerate PO fluids, they will receive IV fluids. And we will also do cultures before any type of antiviral medication is given. Education about the annual flu vaccine is very important for our patients. We also need to provide education on hand hygiene and disinfecting infected objects and surfaces. We need to teach them what worsening signs and symptoms to monitor for. So if their cough is getting worse or if they have shortness of breath, when to seek follow-up care, or even go to the emergency room if the symptoms are severe enough. We also want to make sure we educate on maintaining proper fluid intake and education for any medications they're taking.